18,952 have tested positive for the virus. Out of these 207, 973 have died. In Africa, the confirmed cases stand at 23,254 and fatalities are 903. These numbers continue to rise and there is no indication when this will stop. The measures that the Ministry of Health has been advocating, simple as they may sound, experience has shown that they are most effective. These measures include hand washing, maintaining social distancing, wearing of face masks, quarantine, and basic hygiene. I want to thank our people who have observed these measures. The gains so far achieved that have made it possible for the gradual opening of the economy is owed to their support. I want to urge them to continue with the practice. In the same token, I must say that we have noted with dismay the casual attitude with which some of our people are not observing these measures. We have observed that some eateries are not only operating without any regard to social distancing requirement, but also deep into curfew hours. The transport sector, particularly matatu and border operators, have also gone back to the old normal ways. There is public outcry that some hoteliers are unfortunately not observing the protocols we have established. The government will assess and determine whether these measures can continue or need to be reviewed if need be. My appeal, therefore, to hoteliers, transport industry, and everyone else is to abide by the containment measures already highlighted. If we do not, the spread of this disease will be extensive and will be very difficult to contain. We have also observed that some mosques have revised prayer time and are now opening for prayers at night. I must warn such religious leaders that this contravenes the directive that suspended all religious gatherings. They must stop this practice forthwith, failure of which legal action in accordance with the public health shall be taken against them. Fellow Kenyans, I informed you about the targeted testing as a measure to control the spread of the disease. The exercise has already kicked off in the identified high-risk areas. This has to continue for purposes of containment of infection. The outcome of the testing exercise so far has shown a low turnout in some of these areas. In the last 2 days, the testing teams have tested 803 against a target of 2,000 in Kawangware, 494 in Isli against a target of 3,000. I want to remind Kenyans that there are countries where people beg to be tested, yet their governments are unable to do so. As of now, the Ministry of Health has acquired the testing capacity to undertake targeted testing, but the willingness of the people to be tested is low. I want to appeal to Kenyans to willingly come forward to be tested. If we have to flatten the curve and reduce infections and minimize the risk of transmission, the Ministry of Health is encouraging Kenyans in the target areas to present themselves to the testing teams. Experience has shown that countries that have managed to flatten their infection curve quickly have heavily relied on targeted testing. The tests, of course, will be conducted free of charge. I want to remind Kenyans that as we continue to address COVID-19 pandemic, the other health services must continue to be provided to Kenyans. In this regard, I call upon all Kenyans to continue accessing health services in their preferred facilities. We are aware that Kenyans may be keeping away from utilizing health facilities for fear of contracting COVID-19 from our facilities. I want to assure Kenyans that we are taking every necessary precaution to ensure that those who visit health facilities do not stand a risk of acquiring the disease from those facilities. Our records are indicating low hospital visitation for health services. Let us all be reminded that this kind of health-seeking behavior can lead to other more serious consequences. In the same vein, counties and other health providers are requested to continue providing health services to Kenyans. Yes, COVID is in our midst, COVID-19. It's a pandemic. We are focusing on battling it, but we also have other services to deliver. Regarding quarantine, there has been extensive debate on the status of those arrested for breaking curfew rules. I wish to state that such individuals will no longer be accommodated at the usual government quarantine facilities. Instead, the Inspector General of Police has been directed by the National Emergency Response Committee to designate a curfew breakers holding place. The place must be able to meet the social distancing requirement. Yesterday, our testing team was in Kawangware for the targeted testing exercise. From that activity, we have confirmed 7 new cases. This is a testament that the virus is now domiciled within us and circulating within the community. Fellow Kenyans, our coronavirus situation is as follows. In the last 24 hours, we have tested 883 cases. Out of this, 30 people tested positive for coronavirus. Of these cases, 19 are from Mombasa, 8 from Nairobi, 2 from Bungoma, and 1 from Kitui. Bungoma, you will note, is the latest county to join the growing group of counties that have now recorded a confirmed case, bringing to 16 the total number of counties that have so far recorded COVID-19 cases. So you can see that COVID-19 is spreading across the country. You can tell from the number of counties that keep joining this list. The cases are distributed in the estates as follows. In Nairobi, they are from Kawangware 2, Isli 5, Kibera 1. In Mombasa, the cases are from Mvita 15, Kisauni 3, and Likoni 1. In Kitui, the 1 case is from Wingi town. The 2 cases in Bungoma are from truck drivers. This brings the total caseload in the country of confirmed positive cases to 465. In terms of gender, 23 are males and 7 are females. The age of the new cases ranges from 4 years for the youngest to 64 years for the oldest. We are pleased to inform you that within the same period, we registered 15 more recoveries that have been discharged from our hospitals. I am saddened to inform you that we have lost 2 more patients from Mombasa. Let me take this opportunity to convey our heartfelt condolences to the affected families. Finally, I want to thank Kenyans for their cooperation in this fight against the virus. We need to continue in a steadfast manner to observe the measures that have been put in place. As we have repeatedly said, the only way to beat this virus is to observe those measures. I thank you, and allow me now to invite CS Magoha of Education to make some remarks.
Just 1 or 2 points to emphasize. First of all, you must remember that we operate as one government, led by one leader, by the name His Excellency Uhuru Muigai Kenyatta. So when you see me here in the Ministry of Health, I am not intruding. I am a senior member of government within government. The second point is that I wanted to perhaps reframe what I told you earlier, which has been misconstrued as to whether schools are reopening at the beginning of next month. What I said, and for the record, was one, that even up to this point, the government has not decided to postpone the national examinations. And the second point I said was that the children should enjoy their holidays and that schools shall remain closed effective 4th of this month up to 4th of next month. And I further told you, ladies and gentlemen of the press, that in the interim, a lot of things that will determine whether we consider opening will be discussed by this large committee, of which I am a member. You have eyes and ears, and you can ask yourselves whether in your considered opinion the past week has been good or bad as far as coronavirus is concerned. And perhaps I want to end this by asking you questions, because you are perhaps too young to have children, but you must have brothers and sisters. Would you rather send your children back to school at the end of the month with all these facts that you've just been given now? So if and when we are going to make the pronouncement that we are going to either shift the calendar or open the schools, we shall wait for the appropriate time, which time has not arrived, and that opportunity will come as we together look at what the government is doing. Let me diverge a little bit and say that it is also very disturbing to hear the parents and the public only thinking about school opening and haggling about fees. It is important to remember that this is a medical crisis. It is a medical crisis. It's not an economic crisis. The economic aspect is on the side, and we must control the medical crisis first. Shouting because traffic has gone back to normal, as if nothing is happening. And you brothers and sisters in the Fourth Estate are not talking about it. This is not a Kenyan problem. I've been a doctor for 40 years, and you will allow me to just speak for a minute. This is not a Kenyan problem, so let us stop pretending that it is a Kenyan problem. It's a worldwide problem. And that, as far as I'm concerned, it is our culture that is going to get us to where we don't want to go. So perhaps, since we have worked together, can you help us to sensitize the public that they are celebrating too early, and that it is their behavior, their precise behavior, that will lead us to doomsday? And finally, on the mask, as you move around town, you'll find that about 50% of the people are wearing the masks, but the nose is outside. Tell them the nose has also got to be covered. Like that guy is not safe at all. If he has corona, that one, he will actually infect the people next to him. The mask is supposed to cover you like this. And then another smaller percentage is wearing the mask on the neck. Please help us to sensitize the public about this. Some keep the masks in the pocket, and when they see you coming or the police, then they take it and wear it as if they are wearing it for you. I want to thank you, and I hope that even today, like you did last week, there will be no questions on this matter. Thank you.
Very well. We have an opportunity to ask a few questions.
Thank you very much. I am not
Yesterday, we were informed that majority of the cases that had been confirmed in Kawangware, which has a sizable population in Nairobi, are traced to a healthcare professional. And today, you have also reiterated concerning apathy by members of the public to visit healthcare centers for fear of contracting the virus from those locations. Now, what is the government doing to, one, protect its professionals from contracting the virus, and two, assuring members of the public that they are safe if they are able to go to healthcare centers if cases in Kawangware are traceable to a healthcare professional?
Thank you so much, Satolale, NTV. Buenos CS, we're with you at the Isebania border and the Kenya-Tanzania border, and the governor then did raise issues with the border, and today he has reiterated that that border needs to be closed. And considering the cases from Kuria were all imports from Tanzania, so what are we doing about the border in Tanzania, and what are some of the concerns the authorities in Kenya have? We know the situation in Tanzania, very controversial, if you want to put it that way. Is it a concern to us now that even the CS for Education, George Magoha, professor, did say that it is a worldwide problem? It's no longer a regional issue. That is the first one. The second one would be, of course, it is those who are willing that are going for tests, but when we have hotspots which are very volatile, because even the people who are going for these tests, those who've tested positive, are still mingling with members of the community. At what point will we have what we call forced but cautioned testing, mandatory but cautioned testing? That is my second question. And finally, just for the Minister for Education, just one.
Thank you. My name is Purity Museo from KBC. Professor Magoha, kindly allow me to ask you a question. I know you're hoping not to get one, but my question would be on still the other time you talked to the media, you said the ministry is working on looking at what to do to help, especially those that cannot access the online or e-learning. Probably you can update us, because at the same time you keep on saying that the government has not announced any plans to postpone the national examinations. And then to the CAS, what exactly is the end game to this? Because we are seeing a cycle. We are not talking of imports. The other time you said that we are not talking of imports, especially the two cases that were announced yesterday from Kuria West. Is it a cycle that we are not talking of imports and now community spread? What's the end game to this? The mass testing has proven to help nations ease their restrictions, and most of them are doing that. What are we looking at this month? Are we considering mass testing, or how far is this target testing that you've begun doing? What are your targets?
My name is Chomtai Goin from Citizen TV. First, on the Kawangware and Isli Mombasa issue, are there additional measures you're considering, especially for the hotspots and estates that are increasingly recording higher numbers, possibly even as mass testing continues, and you've stated that very few people are turning up? Will you also consider possibly door-to-door testing as you go forward, as you try to contain, noting that people in these particular areas move around from one place to another? And one question to Professor Magoha. Already you've come out clear on the state of school reopening, but some private facilities, private schools are already issuing invoices and fee notes to parents to start paying fees for the second term. Possibly, what is the direction from the Ministry of Education?
Okay, thank you. Let me start by responding to the question by Mark of KTN. Yes, indeed, we had said that when we look back at the cases in Kawangware, that you could trace it maybe to a healthcare worker. That's true. But coronavirus knows no distinction. It can pass between anybody. So I think using a label of a health worker versus somebody living in that area does not help us in any way, because the virus can be contracted from anyone. None of us is immune to it. Even CSs can get and CASs can get the virus. So let's not compartmentalize it and say, it came from here, and so how do we deal with it? We have to deal with it as a virus that needs to be stopped, that needs to be contained, and that the way that we can deal with it is by, first of all, the healthcare workers and the frontline workers who are out there. We identify them as high risk because they are the ones who are encountering potential patients, potential cases through the services that they are providing. We need to protect them. And I think protection of healthcare workers is key for us, which is why we have ensured that we are able to provide them with the necessary gear that they require there, the full PPE gears, as they go about their work. So we will continue to provide protection to our professionals, but we will also continue to provide protection to those who are not infected and who need to access services in healthcare facilities, by ensuring that in those healthcare facilities we are observing all the necessary requirements of infection prevention and control, so that when those seeking care come to those facilities, they can be assured that there is no risk of them contracting it from touching a surface or interacting with healthcare workers. So I think that is something that we shall continue to do. My friend from the nation, yes, we were together in Isebania, and I think it was quite a very interesting tour out there. Yes, 2 cases have now been reported from Migori. In fact, the governor spoke to me yesterday. I think he had an inkling that cases were going to be reported from his county, so he was concerned. I have even read in the paper today that he has put in some very strong measures. Of course, the reason we went on that mission across to go and assess the borders was to be able to see how we are operating at those borders in terms of prevention and containment. And clearly there is a need to do something. We had decided that all truck drivers who are coming in will be tested. That is still on track, and they will be tested. You can see 2 of the cases in Busia are actually truck drivers. So part of the targeted testing that we will be doing will be testing those truck drivers who are entering into the country, who are crossing those borders with those cargoes that need to be brought into the country or leave the country. So whether the border will be closed or not, I think is an issue that will be determined by the committee, the NAC committee, and I know that they have been meeting today, so maybe tomorrow they might have some announcements to make, I'm not sure. But I think these are issues that are live with us on how we deal particularly with the cross-border movement of people. We are within the East African community. We are working under that framework of mutually discussing these issues because we need each other. And Kenya, we are a gateway for most of the products that go into the East African community and beyond. So we need to be able to consult and agree on the modalities of how we're going to effect the controls that we want to put in place. Purity of KBC. You asked me what is the end game. If I may answer you simply, the end game of this whole thing is to make sure we have no more coronavirus, or we beat the coronavirus. And the only way we can beat the coronavirus is by strengthening and continuing with the efforts we are doing to break the transmission of this virus. Now, to break the transmission of this virus, we need to know where are the places that we need to go, where the virus is hiding, and what are the measures that we need to put in there. How can we tighten some areas where we think that this virus is circulating? And that's where the targeted testing comes in, because it is testing that will inform you about the circulation of the virus within the country and within the communities. We have already, through our contact tracing and mapping, identified hotspots. When we go to Kawangware and Isli, it's because through the mapping of contact tracing, we have identified them as hotspots, and thus we have gone in and done targeted testing. As you can see, we are already picking up people. When you identify people who are positive, you can remove them from the general population, put them in isolation. Many of these people that we have been, who have turned out positive, actually have very mild disease, if any, or are asymptomatic. But you need to still isolate them because you don't want them to be transmitting the virus. Those that need treatment will be treated, and then when they are treated, they can rejoin the community, minus the virus. Therefore, you are not going to be circulating it. So you need to identify where the virus is by doing the testing, and then going in there and doing the containment measures that you want to do. So we'll continue with that effort. I think it is Chemtai from Citizen. In a way, I think I've answered your question as well. How do we get people to volunteer to come and test? You know, we have said repeatedly that we as citizens must also take our own responsibilities in protecting ourselves and protecting others. And by going out to test, I think is a move aimed at protecting yourself and others, because it's important that you know you could be an asymptomatic carrier who's spreading disease. You may be spreading it to your loved ones near you. It is important to go out and be tested, particularly if you are in an area that has been designated as a high risk or a hot spot. So I want to urge those who are in these places to present themselves to be tested, because once you are tested, you know your status, something can be done about it, and you can be prevented from transmitting the virus to others around you. We are working very closely with the communities. In fact, in Kawangware today, as well as in Isli, in the reports, the results that I have given you, this was the second round in those places, and you can see we have already registered many more people who have presented for testing, because between Nairobi and Mombasa, we tested, I think those people who volunteered for testing were around 800 or so. We are working with leaders within these communities. We are working with the communities themselves through their community health workers. We are working with the county governments and the national administration in some of these places, and we are sensitizing people that the need for them to be able to present themselves so that they can be tested for COVID-19. We're already seeing some improvement, and we'll continue to do that and encourage people to come out and be tested. Thank you.
Thank you very much. Let me start with a disclaimer that I'm a law-abiding citizen, and I shall not discuss what is sub judice, but having said so, I would want to say this that may be relevant to the person who asked the question, that I regard myself as a Cabinet Secretary for Education, which means a Cabinet Secretary for all the Kenyan children, both in public and private schools. And when I'm empowered by His Excellency the President to make a policy pronouncement, like the extension of the lockdown of schools for 30 days, it does not discriminate and say this is for the public or this is for the private. So all the schools must comply. If and when I am empowered once again to make a similar pronouncement, it shall be for all the schools. So if there are any issues where people are pronouncing themselves that the second term has commenced, that is not in the Republic of Kenya. Like I told you, we work as one government. On the issue of online coverage, first of all, the public must understand that online coverage is there. It is accessible to all the children, and for fear of repeating myself, there are many media, both electronic and others like the radio, television, internet, and what have you. And the content that is being given has been cleared by KICD. In addition to this, the private schools, because they have capacity, they have developed their own content and they are giving it to children. But I have also said that we know that we are not reaching all the children, and that every effort is being made to try and reach those children by getting, we are actually now thinking about how to get the gadgets to them, because you heard His Excellency the President had launched some balloons a few months ago. Quite a number of those balloons are up there. So it's not going to be an issue of bandwidth, but the issue of the end product, which is either the tablet or the computer or a smartphone. In the meantime, you should be fair to us, because you know we are in a kind of a partial lockdown. So we cannot mobilize people to go and look for those children and give them corona when they are actually in the bosoms of their families. I would want you to understand this very clearly, that this is actually a medical calamity, and all these other things we are talking about, like the disruption of education and other things, they are on the side. So we should focus on the calamity. I have said, for avoidance of repeating myself once again, that when the government opens schools, we shall treat all children as equal, and every child will be given content that that child did not have. And I think for now, that makes me go to sleep, because I am focusing on the disease, not so much on going back to school. Can you imagine, for example, if we were rushed to open schools and you get a child, for example, from the old town in Mombasa, he comes to Alliance High School, and then he infects all the children there. It is you same people who will now turn and say, well, government did not consider. So give us time to do what we know how to do professionally, the best way we know how to do it. Thank you very much, and God bless.
Mengi yamesemwa kuhusu jinsi virusi hivi vya corona vinavyosambaa na kuzuiliwa. Hata hivyo, sio yote unayasikia ni ukweli. Uongo mwafanya watu wengi kuishi kwa woga kote ulimwenguni. Nimekutana na watoto wengi wakisema kuwa mbu, yani mosquito, husaidia kusambaza virusi hivi.